Doctor Lilja, le pregunto yo una cosa. ¿Qué piensa usted, después de su estupenda charla, que las guías americanas de urología recomienden empezar el screening a los 55 años, en ausencia de factores de riesgo? ¿Considera que es una edad demasiado extrema? ¿Cuál es su opinión? Porque ahí las guías europeas y americanas sí que son diferentes.
So we have studied the problem using the same approach that so using the same approach that I showed for the Göteborg screening study for men age 60 and the Malmö population age 60. And comparing that setting, we have done exactly the same, or not exactly the same, but something very similar, using the Göteborg men age 50-54 and the Malmö men age 51-55. We don't get 100% overlap, but close to look at, and then having 17 years of follow-up in the Göteborg study, and clearly longer than that, but using a cut point of 17 years in the Malmö data. And we reported that as a poster, I can't remember, AUA, I'm pretty sure it was at AUA. But it was either at AUA or EAU last year. It is in submission in multiple revisions at a very highly ranked European urology journal. But it isn't accepted for publication yet. The data are very, very clear in terms of the mortality reduction effect in that setting in the Göteborg study, which wasn't clearly obvious in the 14-year data that so far have been reported from the Göteborg data. But if we compare these populations that are likely highly comparable, it suggests to us very strongly that we have a very important effect in the younger man, and the number needed to screen and the number needed to diagnose were very low. I think the number needed to diagnose or treat was somewhere in the range 10 to 12, and the number needed to screen were in the range of 30 or something like that. So, so clearly from that, we can see that there is evidence that you get important cancer mortality reduction benefits. And then everyone who is involved in guidelines and so on need to think about what these data mean and how you should do. But I mean, this is what we can contribute to the field so far.